We are live here on YouTube, and we are going to be connecting with Blog Talk here in about 50 seconds. So hang in there. We're going to start today talking about the powerful role of nitric oxide. No, not as weightlifters, but in intestinal health. So stay tuned for that. We'll get started here in just a minute. Hopefully you're having a good day. By the way, before we get started, my response to the 3-day seminar that I attended here, the faith seminar, the freedom seminar this past week here in Tampa, was my takeaway message. A lot of people use the big F word a lot in a very derogatory way. What was that F word?
Your show will go live in 5 seconds. 4,
here we go.
3, 2, 1. Blog Talk Radio.
The information you hear on the Nutrition Shop's Health Talk with Dr. Len is intended to be educational and not intended to diagnose or treat disease. Individual concerns should be addressed to your health professional. It's time for the Nutrition Shop's Health Talk with registered pharmacist, clinical nutritionist, and naturopathic doctor, Dr. Len Branswitz. He's here to use his knowledge to impact your health and change your life. Get more information on the website at nutritionshop.net. Right now, you can call the Nutrition Shop's Health Talk at 347-989-8205. That's 347-989-8205. And now your host for the Nutrition Shop's Health Talk, Dr. Len Branswitz.
And hello, everybody, and welcome. We're going to talk today about intestinal health. Why? Because the survey says 4 out of 5 individuals, adults in the United States, are having gastrointestinal problems. Constipation, diarrhea, bloating, gas, whatever it is, reflux, fill in the gaps. And there's a world of supplements out there that are helpful, and a world of pharmaceuticals out there that are helpful. And there's a whole world of gastroenterologists that try to help. But I'm going to share with you some information that was just recently published in the Townsend letter by a cohort of mine by the name of Elizabeth Shirley, a fellow pharmacist, a fellow CCN, board certified in clinical nutrition. Nice to see one of ours get published. She did this piece. I'm going to quote from it, and I want to thank her for sending it over so that we could share it with you. So we're going to talk today about something you may think has been related just to weightlifters. Oh, I'm going to build nitric oxide. Or men with ED. Oh, we need some nitric oxide. So we're going to talk about nitric oxide and how a simple switch in your dietary habits could turn your gut health around for the positive. Okay, for those of you that aren't aware of Blog Talk Radio, this is show number 831 that we have done with Blog Talk Radio, our podcast, and we do start every show out with the national anthem. And again, a special thank you to all our military, all our first responders, all our police, firemen, those that keep us safe. Thank you for what you do. All right, since you're probably one of the 4 out of 5 that are having gastrointestinal problems. So let's get into this. The gastrointestinal tract encompasses a complex balance of microbes, hormones, neurotransmitters, and enzymes. All that happening in your microbiome. The health of our gastrointestinal system is dependent upon this balance. And it's extremely important for longevity and well-being. The health of us, how long we're going to live, how healthy we're going to stay. The GI system not only controls physical wellness, listen please, it's also integral to mental health. This is due to the gut-brain connection, the communication between the intestinal tract and the brain, which plays a critical role for our mental as well as physical well-being. Anybody that has severe gut dysfunction, that will exacerbate the symptoms of brain disorders, specifically affecting your quality of life. The intestinal microbiome also influences your metabolic rate, i.e. your weight, and your immune pathways, your capability of fighting off things like COVID, as well as your genetic and epigenetic factors, what you've inherited, all aspects of physiology. Disruption of the intestinal microbial ecosystem, known as dysbiosis, has major impacts in health. It's been associated not only with gastrointestinal, but also neurological, cardiovascular, respiratory, metabolic, oncological disease. So, you know somebody that's having gastrointestinal problems, neurological problems, heart and cardiovascular, respiratory, can't breathe, metabolic, gaining weight, blood sugar issues, diabetes, or cancer. I think that encompasses about 90% of everything. Therefore, a rich, diverse intestinal microbiome is essential to our mental, intestinal, and overall health. Yet, according to the Centers for Disease Control, 5 out of 6 individuals in the U.S., listen to this, receive 1 antibiotic prescription each year. 5 out of 6. This leads to alterations in the microbiome and increases dysbiosis. So how do I fix this? We're going to throw the answer out first and then delve into a supplement at the end and what you can do right now if you fall into any of these categories. A nitrate-rich diet, which supports the nitrate to nitrite, and keep in mind, nitrites are what our body's looking for. Nitrites then feed nitric oxide. So we eat nitrates, we digest them and properly process them to nitrites, which again go into the liver, into the nitric oxide pathway. That can help prevent dysbiosis and promote gastrointestinal health, as well as support the gut-brain axis and maintain homeostasis for your health. The highest, here's your clue right from the start. The highest nitrate-containing food sources include arugula, spinach, butter lettuce, bok choy, celery, and beets. Dietary nitrates and their metabolites are correlated with healthy oral, gut, and intestinal microbiota. Further, nitrates may modulate inflammatory pathways. You got pain? Immune system issues. You have allergies? Oncological pathways. I'm fighting skin cancer. Maybe recovering from a cancer treatment. Nitrates also provide protection against toxicity induced by what are called LPSs or lipopolysaccharides, an endotoxin that causes pro-inflammatory cytokines. What's that do? Causes something we've talked about many times called leaky gut syndrome. Okay, having a healthy, let's start in the basics again. Having a healthy mucus layer is our first line of defense against pathogenic bacteria in our gut. It's a critical protective layer that balances good and harmful bacteria. The mucosa of the GI tract is continuously exposed to potentially damaging substances that can affect gastric mucosal integrity. Alcohol, nicotine, drugs, Helicobacter pylori, bile salts, ischemia, reperfusion of gastric tissue, chronic stress, all can lead to factors in mucosal damage and gastric ulcers. Listen to this. I highlighted this in yellow. Nitric oxide appears to be one of the most important signals for mucus secretion, as it is a mediator responsible for the cholinergic stimulated mucus release. Nitric oxide increases mucosal blood flow. That's why weightlifters have used it. That's why men with ED have used it. This acts to dilute toxic substances, neutralize them, and remove them before they accumulate into damaging concentrations, supporting the nitrate to nitrite to nitric oxide pathway. You don't need to know all the biochemistry behind this, but it's amazing if you look it up. This increases mucosal blood flow, causes vasodilation. All of the vasculature open up, increases mucus production and thickness, modulates mucosal immune response, prevents acute peptic ulceration, and even repairs the damage that non-steroidals may have done to your intestinal tract. All with some changes in food. You think you could add beets to your diet a couple times a week? Or use, I don't know about you, if you've ever had butter lettuce, it's a little expensive, but boy, is it good. So, tight junction proteins. This is where we talk about leaky gut syndrome, which causes a myriad of allergy potentials. If you got it, and we go and do testing to find out food allergies, that list explodes. May not be a problem, but it explodes. Tight junction proteins play a crucial role in epithelial transport and are responsible for barrier integrity in the intestinal tract. Loss of this tight junction proteins results in the breakdown of the intestinal barrier called leaky gut. There is decreased gastric expression of the tight junction proteins. However, following nitrate consumption, both protein levels, occludin and clotidin, you don't need to know that, rebound. Got leaky gut? Add that forms of lettuce and some bok choy to your diet every day. So let's look at the role that antibiotics would play in disrupting this thing. Broad spectrum antibiotics decrease microbial richness and diversity, and most of us sit back and say, okay, I'm just going to take more probiotics. Not a bad idea, but if we have to go there, we have to make sure that we do the correction. The use of antibiotics has long been linked to intestinal disorders, leaky gut, and even mental health symptoms, including anxiety, depression, brain fog, and severe fatigue. Dietary nitrates have a supportive role to play during antibiotic treatment. So if you're taking an antibiotic for whatever reason, this is when we go back to arugula, spinach, butter lettuce, bok choy, celery, and beets. Didn't know that, did you? That maybe just chewing on some celery with some good nut butter on there while you're taking the antibiotic could allow the gut to heal. The oral microbiome, your mouth, may modulate the activities of the gut microbiome. Studies have shown that alterations in oral flora can cause an imbalance in the gut flora, which can increase the pathogenesis of gut disorders. It's known that 45% of the bacteria in the oral cavity and the large intestine overlap. We're constantly seeding the intestinal tract every time we swallow or eat. One of the reasons we like that prep called Probzymes. It's chewable, soil-based, probiotic that can help populate the oral mucosa. Nitrates increase nitrate-reducing bacteria on the tongue and decrease levels of the bacteria that are associated with poor oral health. Nitrate supplementation is able to prevent or reduce bacterial dysbiosis and stimulate eubiosis by increasing the beneficial healthy bacteria and decreasing levels of disease-associated bacteria. Now, we're going to be talking a few minutes about a prep called CircuCor, which right on the label says increases nitric oxide. It's been used for hypertension. It's been used for heart failure. We've used it for recovery post-vaccine. We've used it to prevent blood clots. I mean, we can go down the whole list. Several recent studies have suggested that nitrite can be used as an alternative to standard antibiotic therapies, owing to its ability to disrupt the protective biofilm formed by pathogenic bacteria. Celery, superfood. Beets, superfood. Spinach, superfood. Furthermore, supporting the nitrate to nitrite to nitric oxide pathway ameliorates inflammatory cell infiltration, regulates microbial dysbiosis, and restores your beneficial bacteria. Nitrates protect the gut microbiome under inflammatory conditions and restore local immune and inflammatory support. Furthermore, nitrates and nitric oxide can regulate the activity of mast cells. And I know there's going to be a listener out there right now that I'm dealing with that has a mast cell issue. If you've ever seen the prescription drug Singulair, if you've had allergies, if you've had asthma issues, we can see that that could be one of those issues. Mast cells are white blood cells that are part of the immune system and function as a bridge between the immune and nervous system. Mast cells modulate the inflammatory processes in depression and anxiety, brain fog, insomnia. Mast cells become activated in the absence of nitric oxide production and increase superoxide production, which contributes to mast cell activation. Conversely, nitrates and nitric oxide are an effective inhibitor of mast cell-dependent inflammatory events. Nitrates and nitric oxide suppress antigen-induced degranulation and mediator release, stops the histamine release. Celery, beets, spinach, bok choy. Mast cells are important effectors of the gut-brain axis by translating stress signals that release neurotransmitters and pro-inflammatory cytokines. So you got stress in your life? Chronic stress causes inflammation to damage all cells in the body, including the GI tract. Constant stress can alter GI motility, change GI secretion, increase intestinal permeability, decrease regenerative capacity of the mucosa and the mucosal blood flow, has a negative effect on intestinal microbiome, and inhibits the production of nitric oxide. Conclusion. Dietary nitrates clearly play an important role in protecting GI health. Nitrates inhibit the inflammatory process and downregulate scavenges oxidative stress. Furthermore, nitrate is a powerful modulator of the microbiome, and microbiome diversity is the foundation for health and longevity. A nitrate-rich diet which supports the nitrate to nitrite to nitric oxide pathway may help prevent dysbiosis, promote a healthy gut-brain axis, therefore support both gastrointestinal and mental health and maintain homeostasis. Thank you again, Elizabeth Shirley, a 40-year pharmacist, like me. So I want to go back now and just talk for 1 second about CircuCore. I'm going to go through this prep. 120 vegetarian capsules in a bottle, has vitamin C, which exhibits a wide variety of benefits in the body. We know that. Has quadrifolate, a member of the B vitamin family. Adequate dietary intake of folates necessary for health. And here it is. Beetroot powder presents some exciting possibilities for supporting cardiovascular, and now we know gut health because of its natural high nitrate concentration. Beetroot powder may potentially reduce triglycerides, regulate blood pressure, and other cardiometabolic processes, optimize blood flow through the body. Supplementing with red beetroot powder has shown to reduce blood pressure, cholesterol, and the inflammatory marker HSCRP. A 2018 study showed that dietary nitrate supplementation in the form of beet juice can help improve blood flow during exercise with patients in congestive heart failure. Another ingredient, Activin, registered trademark grapeseed extract, a proanthocyanin. Research studies have shown that Activin possesses a wide range of antioxidant properties. Hawthorn herb, traditionally been utilized as a tonic for the heart and circulatory system. L-citrulline, an amino acid that the kidneys convert to L-arginine, and here it is again, nitric oxide. And L-arginine, a semi-essential amino acid that enhances production of the vasodilator, nitric oxide. See what I'm saying, folks? You put together the right prep at the right time as you're dealing with corrections of a gut issue, you can make an amazing change in your health. Here's a little bit on the microbiome. Please listen.
Probiotics have been all over the news lately, especially now that both researchers and celebrity doctors alike are confirming the major connection that our microbiome has to our overall health. Despite its newfound popularity, many of us are still unclear about what exactly our microbiome is, why we need probiotics to help keep it balanced, or which supplements are the best to take. With that in mind, we've looked at years of research about the microbiome and its effect on our health. Right now, 90% of the cells in your body are microbial. These microbes, a general term for bacteria, and other molecular organisms are present throughout our body. The human microbiome is a collection of all these microbes. This means, you guessed it, 90% of your body is actually your microbiome. Keeping it balanced can have huge benefits, not only for your digestion, but for your brain, your skin, your immune system, and a host of other functions. In fact, researchers are now only scratching the surface of the potential of probiotic supplements and why they're essential for our overall well-being. Unfortunately, many of us still don't realize that even though our digestion feels normal, we still will need a quality probiotic supplement to keep us healthy. 10 quick ways you're hurting your gut bacteria. Number 1 is sweets. Number 2, wine and beer. Number 3, poor sleep. Number 4, antibiotics. Number 5, not enough fiber. Number 6, living in the city, pollution. Number 7, water containing chlorine. Number 8, foods with artificial coloring. Number 9, antibacterial soaps. And number 10, non-steroidal anti-inflammatory pain relievers. They can disrupt your digestive flora. More information, please call our staff at 678-228-8900. That's 678-228-8900. And I look forward to talking to you about your microbiome.
Okay, so if you have any questions about what you heard today, you're still confused. Now that this is a YouTube video, once it's posted, go look at it again. Share it with somebody. Share it with somebody, would you please? And for those of you listening on Blog Talk Radio, share that podcast with somebody. The powerful role of nitrates in intestinal health. If you've been battling that, emotional health, neurological health, diabetes, this was a show for you to listen to. And again, you can reach me at the office at 678-228-8900 or check us out on our website, The Nutrition Shop, SHOPPE, thenutritionshop.net. A lot of new stuff there. All right, be back with you again tomorrow. God bless you, folks. Have a great, healthy day.
I hope you received your daily dose. Remember, you can go back and listen to this information again at blogtalkradio.com or at our website, thenutritionshop.net.
Thank you for using Blog Talk Radio. Goodbye.